Um, my name is Jennifer Morse. I'm the Medical Director for Mid-Michigan District Health Department, District Health Department number 10, and Central Michigan District Health Department. That does cover 19 counties, and so for the respective time and our ability to be able to talk with all of you, we decided to hold this conference call. And as needed, we'll work on doing more individual or group discussions as needed. I'm going to turn it over to Luke, who has graciously offered to hold this conference call for us to just talk about some of the technical details for today's call.
Thank you, Dr. Morse. My name is Luke Orner. I'm the Region 6 Healthcare Coalition Coordinator, and you are all logged into Microsoft Teams. If you're logged in on the computer, at the bottom of your screen, if you wiggle your mouse around, you'll see a bar. At the bottom of the bar, you will see a little microphone that is the mute/unmute button. To mute yourself or to unmute yourself on the computer, go ahead and just click that, and that will allow you to speak through the computer. If you are called in on a phone, you will have to press *6 to unmute yourself, as I have muted everyone currently. If anyone has any technical difficulties, feel free to type it in the chat section. You can go ahead and press the show conversation section, as someone just did, and that will pop up. Please remember that everyone will be able to see what you type in there. For questions, we will be holding questions until the end. You will have two options to answer questions or to ask questions. You can either type your question in on the chat section and I will read them out loud, or you can type in your name and the word question and I will call on you to ask your question. Thank you very much. And Dr. Morse, it's all yours.
Great, thanks so much. So as you can all appreciate, everything is changing very rapidly. I'm hoping that things are as up to date as possible. I'm hoping that we'll have plenty of times for question and answer at the end. This is being recorded. We will share the link to the recording with all those that we emailed out the invitation to, and you can share that with colleagues who may not have been able to join the call today. Let me try to advance my slide. Okay, there we go. So I did just update this morning. So this is the number of cases. Oh, shoot. Okay. This is the number of cases as of this morning. Unfortunately, the little text box for the Microsoft Teams is right over the count of cases, so I can't read the number there. But yeah, this is as of 9 a.m. this morning. I did put the website here on there. This is a website that was developed by Johns Hopkins, and it is updated very frequently, and it helps to just give you an idea of what's going on, the number of people that have recovered, the number of deaths. So it's just a very interesting website. I'm just going to go through the epidemiology really quickly. I know we do have some individuals from the healthcare centers of the universities here, but I also wanted to just emphasize how this, from what we know so far, is mainly a concern for older adults. However, there likely is disease in our younger adults and children that we aren't recognizing because it is so mild. So the World Health Organization did do a very intensive review of cases in China. So as of February 20th, they looked at 555,000 plus cases that were lab confirmed. So only 2.4% of those were in individuals who were under 18 years old. 3/4 of them were in people that were 30 to 69. So the majority are in older adults, not that over 30 is older, but again, not really our college age students. Infected children, which are those under 18, were really identified as they were doing contact tracing. So as they looked at individuals that were ill, they were finding sick kids that were in the households of those adults. No one could identify, of those 55,000 plus people, no one could identify where the initial person sick was a child and that child passed it to an adult. It was always the adult was sick and passed it to the child. Only a very small proportion of those under 19 developed severe illness or critical illness. Of all the people that were sick, 80% had mild to moderate disease, 13.8% had severe disease, 6.1% were critical. There were some asymptomatic infections reported. Likely as we get serologic testing and can review this illness over the years, we'll likely find that there are more and more that were infected and were either not recognized or were asymptomatic. So, as of the 20th of February, again, looking at the diseases in China, the crude fatality rate, so the percent of people that had died was 3.8%. However, that was variable depending on the time of the illness and where they were ill at. So those in Wuhan actually had a fatality rate of 5.8%. Other areas of China had a fatality rate of 0.7%. They found that in Wuhan, there were a lot of delays getting healthcare because they were so overwhelmed. In China as a whole, they found that those who were sick earlier, so in the beginning of January, the case fatality rate was 17.3, and then those who were ill into February, who began to get ill into February, the fatality rate was 0.7. Again, those who were ill later on into the outbreak were getting health care earlier on into their illness. And the highest mortality rate overall are in those over 80 years of age. So I just wanted to go over that just to really paint a picture about who our most at-risk individuals are, and that our understanding of the severity of this illness has been changing. I don't want to minimize the severity of this pandemic, but I just want to try to give an understanding of what we know now. So mitigation strategies have been well defined by the CDC. They put out a really good paper describing this, and actually if you go to the homepage of the CDC, it's one of the links you can click on from the homepage. So they describe the level of disease as either none or minimal, moderate, or substantial. So none or minimal is when you have evidence of isolated cases or limited community transmission, transmission. So that's kind of what we have in Michigan right now. Moderate would be widespread or substantial transmission with high likelihood or confirmed exposure within communal settings. Substantial is when you have large scale community transmission and your healthcare staffing is impacted. You have a lot of cases in communal settings. So that's, you know, what you might have seen in China. So again, we're right now in the none to minimal category. What the CDC recommends for mitigation activities for colleges and universities specifically. So they have different strategies for different settings. For colleges and universities with no transmission in the community. So that would be in the 19 counties in these 3 districts, this would be what the CDC recommends, is just to know where to find information, which would be the CDC or the Michigan websites. Know what the signs and symptoms are and know what to do if you have a student or staff that becomes symptomatic. Work on your emergency operation plans. So plan for social distancing measures, distance learning if feasible, so make plans for that. Evaluate whether there are students or staff who are at increased risk for severe illness. So later on, I have a slide that really explains the groups that they have found to be at higher risk, regardless of age. Encourage students and staff to stay home if they're ill and to notify school administrators of illness. And really try to make policies that won't punish sick leave for staff or students to stay home. Continue to encourage the personal protective measures, so staying home, washing hands, proper respiratory etiquette, things like that. Clean and disinfect frequently, touch surfaces, and make sure you have enough hand hygiene supplies in your buildings. So make sure you have adequate soap, trash cans, hand sanitizer where there might not be enough of those things. So that is what the CDC recommends colleges and universities do right now based on our current level. What the CDC recommends colleges and universities would do if we were start seeing minimal or moderate activity in our community is start implementing social distancing measures. So start reducing large gatherings, Change schedules. So you might stagger the times that classes are excused so that you don't have huge amounts of people together on campus. Start limiting inter-school interactions and consider distance or e-learning in some settings. You might consider regular health checks, like checking temperatures or screening for respiratory symptoms. You may consider short-term dismissals of school or extracurricular activities if needed. And students that are at increased risk of severe illness, which we'll go over later, should consider what plans they might have for distance learning or actually be allowed to learn from a distance. So in areas where there's substantial spread, that's where you would consider longer-term school dismissals, cancellation of school associated congregation, and implement distance learning. So this is a long list, and it is in that document. Again, I have the reference there on the bottom, and it is on the CDC website. But these are the conditions that, regardless of age, do put people at higher risk for complications from COVID-19. So certain blood disorders, chronic kidney or liver disease, a compromised immune system, recent or current pregnancy, endocrine disorders, primarily diabetes, metabolic disorders, which are pretty rare but do exist, heart disease, lung disease, and certain neurologic or neurodevelopment conditions are among those. So those are individuals that may want to take earlier or more substantial preventative measures. Now, just last night, many of you are aware that our state did make some interim recommendations for community mitigation strategies. These are a bit more aggressive than what the CDC recommends, but what they recommended for universities and colleges, and this is actually a copy and paste from the recommendations, is to educate students and communities about COVID-19 and preventative hygiene practices, regularly clean and disinfect frequently touched surfaces like doorknobs, keyboards, cell phones, light switches, encourage staff and students to stay home when sick, cancel or postpone large gatherings, conferences, and sporting events, which they define as greater than 100 people in a shared space, which again, that's a bit more aggressive than what the CDC recommends. Consider telelearning opportunities as feasible. Communicate and reinforce best practices for hand washing and covering coughs and sneezes. And student and faculty at risk for severe illness should implement plans for distance learning. I also included in here the state's recommendations for workplaces because, after all, your colleges and universities are also people's workplaces. So it was very similar. Encourage people to stay home if they're sick. Communicate those non-pharmaceutical interventions, which include coughing, sneezing properly, washing hands, cleaning surfaces. Encourage staff to telework when feasible, particularly individuals at risk for severe illness, which is a bit more aggressive. Implement social distancing measures as feasible, including limiting in-person meetings. Other things might be, if people share offices, you might try to split them up. Social distancing is trying to keep people more than 6 feet apart from each other as much as possible. Limit non-essential work travel, cancel or postpone large gatherings, conferences, and sporting events. Discourage employees from eating meals in a large group setting, such as a cafeteria, and tailor continuity of operation plans. So how will you function if you have a large number of employees ill or working from home? So I also included information that they suggest for other mass events, because your institution may host mass events or have other mass events because of games or other things. So again, consider canceling or postponing large gatherings, cleaning, and other respiratory hygiene recommendations. So again, these just came out last evening from the governor and our state medical director. Again, they are more aggressive than what the CDC recommends, but I believe the goal is to take a more proactive approach. We have 2 cases in Michigan. They are not connected. There has been no community spread in the state of Michigan at this time. So why do we have mitigation strategies? The reason why is that this virus is very infectious, and the fear is that a very large amount of our population could become sick all at one time. So that dark purple curve is what we don't want to happen, because our healthcare system would become very overloaded. Our workplaces would not have anyone to work. It would just be very challenging. So we want to try to make the hashed line curve happen, where we may have the same number of people sick, but it would be a more slow and gradual process. However, there was a really good editorial by one of the senior scholars at the Johns Hopkins Center for Health Security. These individuals are often given testimonials at Senate and do a lot of work with biohazards and with this pandemic. She wrote a really good editorial about why we don't need to close schools to fight this virus. It did focus more on the K through 12 educational system, but really this virus is different than influenza, and we just don't have evidence that closing schools are going to slow this outbreak. Influenza does affect children and young adults much more than this virus appears to. And when schools were closed for H1N1, even though kids were told not to, most people still get together outside of school. And that's, a concern with schools and colleges too, is that you might have a lot of young people still congregating. It's really too soon to tell. And understandably, we all have to do what we can do to be as safe as possible. But again, it was just an interesting editorial, but mostly focused towards the K through 12 grade level. So other considerations for colleges and universities to think about, we're kind of past spring break and other travel, but those are things to think about. Other visitors that will be coming to your campus, like if you're doing recruiting, if you're doing tours for incoming freshmen, those are things to think about. Obviously, international programs, most of those have been shut down. Any large campus events, absenteeism, program campus closures. I know a lot of those have already taken place, but some may still be considering it. And finally, discrimination and xenophobia we'll talk about as well is a big concern. So talking about international programs, you really want to make sure you know where your students and staff are. Do you have any faculty that are working abroad? Are they on sabbatical, doing research? Have you accounted for them? Do you need to do anything to help them get home? The other thing that happened last night at about 9:15 is that Europe basically got shut down to travel any place but the United Kingdom, and all United States residents need to return ASAP, and no travel will be allowed there for the next 30 days. So we have a lot of US citizens that are really rushing to get back home. I just talked to one parent this morning that's very concerned because in order to get his daughter home from Germany, she has to fly to Paris and then take a bus somewhere else. And so actually, to me, it sounds much more concerning that she's going to have even more opportunities for exposure than if she had just been allowed to finish her planned trip. So once individuals do return to the US, will you have a protocol that's any different than what is already programmed by the local health? So currently, and I didn't check this morning to see if the CDC put anything up new to address our returning European travelers, but currently travelers returning from areas with widespread transmission, which again, as of last night at 9 o'clock, was China, Iran, South Korea, and Italy, will receive instructions to self-quarantine and be advised to actively monitor themselves for symptoms of illness. And those coming from China and Iran, we at the local health department are notified of their return, and we do monitor and follow them for the 14 days after their return. So if you have students that are in quarantine, again, these are individuals who are not symptomatic and we're just watching them to make sure they do not become ill. They will likely need special assistance from you at their campus. And there is a nice document that was put up by the American College Health Association called Preparing for COVID-19. And it really goes through all the things you need to consider and prepare for to help a student who may be in quarantine or isolation. Currently, there are no, well, as of 9 p.m. last night, there were no other quarantine recommendations for other international or U.S. locations, but people were recommended to self-observe. So they were recommended to watch for fever or respiratory symptoms for 14 days, but they did not need to quarantine themselves. So again, another fear is xenophobia, fear, discrimination. The origins of COVID-19 and current travel warnings may lead to xenophobic responses. We have had calls recently about people not being allowed to return to work because their workplaces are concerned that they could be infected, even though they've had pretty benign travel and are not ill. You know, those are the kinds of things we worry about with school and work and other things. The other thing too is that some school community members, whether they're students or staff, may still have family and friends that are in those areas. So you may have someone of Asian descent that has family that's in China, or someone who's from Italy, or who's has a military family that's stationed in Iran, who is really nervous and struggling with fear about their family member and needs support. You want to encourage people who might be facing discrimination or concerns about these things to be able to speak to somebody. If you're doing travel histories, obviously you don't want to limit it just to certain individuals or people from certain parts of the world. There are numerous resources that are out there to help with stigma, and there are numerous resources out there to help with mental health issues during this. There's a lot of fear. There's resources to help with people who have to be in quarantine or isolation, because that is a very challenging situation too. So I'd put a lot of those resources there for you. The other thing is emergency preparedness. I have a feeling many of you have been working on this. Again, the American College Health Association has put together a really good guideline, and it really works through how to put together different committees and groups to prepare for this. There's also a great document that goes through lessons learned from H1N1 from Big Ten universities. And there is another link I put there that just has different articles based on that research, describing like how MSU arranged for housing for people under isolation. There's many other universities that share their stories about how they worked in isolation, how they created phone triage, different things like that. So looking at influenza pandemic preparedness guidelines are very helpful. You just need to ignore the descriptions of influenza, flu shots, and antivirals, but everything else is really applicable. Other things to think about, of course, is housing and residential life. You want to make sure you have plenty of tissue, trash cans around, and then put reminders around for like cover your cough. Air circulation can be helpful, so as it gets warmer, opening windows to get more air circulation. If you have someone who is under quarantine or isolation, if you have a room that has more air circulation, that is helpful. Making sure you have enough hand washing supplies, have reminders up to for hand washing around areas where people eat or use the restroom, have plenty of hand sanitizer in areas where hand washing supplies are not available. And then things you can do to perhaps help with social distancing, like move desks apart or put fewer chairs at tables. If you can identify rooms that are not being used in dorms that you could reserve for individuals who are being quarantined or isolated, that would be useful as well for those who are still doing face-to-face instruction at this time. There are recommendations on the CDC within the college and university section that does go over cleaning and disinfection. This really does not need any particular disinfectant. Basically, whatever you would use for everyday cleaning and disinfection is sufficient. You also want to ensure continuity of meal programs. If you do have to discontinue education, or you have people in quarantine or isolation, for those who do not have, if you're not doing face-to-face instruction, if you have people that cannot go home, you want to make sure you're able to feed them still. So I did put some additional resources on here. Again, the CDC does have resources for institutes of higher education. The readiness and emergency management for schools has quite a bit of information on how to work on an emergency operation plan. They have other resources on there as well, and they have plans to help you do tabletop exercises and other things like that. The education department has a page with coronavirus information, and there was a document put out that does give some information about, I think, financial aid with, what happens if you have to interrupt study. I did put contact information here, kind of one point of contact for each of the 3 health departments. And I did list the counties that each of these health departments cover, so you can kind of identify who you would contact. Again, what we can do is once this recording is finalized, we will email you the PowerPoint and the recording to all those that we emailed the invitation to. And then you can feel free to send that to any colleagues you think might benefit from this information. And with that, I think I'll open it up to any questions people might have.
Okay, so at this time, feel free to type in your question in the chat section, or type in your name and the word question, and I will call on you to ask your question. Thank you. Dr. Morse, at this time, there are no questions. We'll give it another 30 seconds or so for you to type in your question. Okay.
All 3 of these health departments also have websites. It's just their acronym.org. So DHD10.org, CMDHD.org, and MMDHD.org. They all have on their home pages a link that's very obvious for coronavirus information. And we're trying really hard to keep those up to date as well. And for those of you who are in the medical clinics, we are doing a talk for healthcare providers on Tuesday at noon, and we'll talk more about providing healthcare, testing and things like that. So that's why I didn't talk much about that today. So those of you, again, who do provide healthcare, feel free to join that call. And if you didn't get information on that, feel free to reach out to your local health department.
And I do have a couple questions coming through from Mid-Michigan College. How long does the virus last on surfaces?
That's really been evolving. There have been a couple good research studies that have come out. One looked at coronaviruses in general. Depending on the surface and the temperature, it's usually a couple of days. It can be up to 9 days, but it's hard to know if it's still infectious. There was another study that just came out specific to this virus. I haven't had a chance to read the whole thing, but it also looks like it's a couple of days. Again, hard to know how infectious it is. So it's kind of similar to the flu. But as far as they know, there haven't been any cases caused by fomites or objects that have the virus on it. I don't know how they can say that with any certainty, but that was, I saw that in a presentation, a physician, an expert said that, but really that is not one of the bigger concerns It's more respiratory droplets with face-to-face interaction.
And next question comes from Renee Kern. We have a question about self-isolation and roommates. Renee, would you like to unmute yourself and ask your question, please?
Hi, this is Renee. So my question was a little further down. So if we have a student that's self-isolating with no symptoms, but has a possible exposure, the bigger issue we're having here is with roommates. And, you know, they're all kind of saying that maybe they should self-isolate as well because they've been in the room, and you know, how far out does this go? And I know I talked to Dr. Morse earlier in the week, and she had expressed that contacts of contacts are not at risk, but we would just like, you know, some more information that we can present here on campus.
Yep, and I can try and find that, but and just to clarify for the group, isolation, it's really confusing, but isolation is when someone's sick. Quarantine is when someone's been exposed and is not sick. Just for the sake of clarity. So if someone's under quarantine, they have potentially been exposed and we're waiting to see if they get symptoms. So we do not consider them contagious at that point. So the contacts of someone in quarantine do not have restrictions. If the person in quarantine develops symptoms, then the contacts would go into quarantine. I can try and find something in writing to show that. Now, if someone were in isolation, they would have to be alone with absolutely no contacts at all because they would be considered contagious. Now, for the sake of mind of those roommates, if they feel unsafe, you may have to provide private quarters for that person under quarantine. However, you know, people that are under quarantine, like that, we have people that have come back from travel, you know, we don't make them, we try to keep them in their own room and things like that, but I'll try and find something in writing that you guys can have, and I'll try to, so I can send it out with this email.
Okay, thank you.
Yeah.
Another question. Can you expand on recent CDC decision making Europe a level 3, and I'm assuming travel restriction?
All I know is the little bit I read about what the president said. And I think the rationale was that there was so much person-to-person spread occurring. And that is what led to the recommendations for Iran and Italy. But they have had huge amounts of person-to-person spread. And I know that's why Italy was added. In terms of all of Europe, you know, I have not personally been following Europe as, you know, I've been watching the travel recommendations to know that Italy is a category 3. But I didn't, you know, I don't know why all of Europe was lumped together. So again, that just came out between 9 and 9:30 last night, and I honestly haven't heard more about the rationale behind it.
Another question from Mid-Michigan College. We have students returning from spring break next week. If students have been on cruises, should they self-isolate for any given time?
So anyone who's had an exposure on a trip should be, you know, if it's on a cruise or on a flight, at the time that they get off the flight at the airport or they disembark from that cruise, they will be screened and educated. If they did have an exposure or it's from one of the level 3 countries, they will be advised that they need to quarantine themselves. If it is a country where it's kind of moderate or mild risk, they will be given instructions to self-observe. If there have been cases on the cruise, we've kind of seen what's happened with those. Those individuals are quarantined on site, which has been a real issue. And oftentimes we're notified at the health department about those individuals. So if they return to school, you should be safe to assume that they have been cleared to return. The only issue would be if they're ignoring the recommendations they were given when they, if they were advised at the airport, you need to self-quarantine for 14 days and they are ignoring those recommendations. It is stated by the CDC and by us that it is not the school's responsibility to try and screen all of their students and enforce quarantine and isolation. There's just really no way you can do that. We have not really seen much problem that we know of, and even in our own work to monitor people in self-quarantine, of people fighting against or ignoring recommendations. Certainly you can do things differently. You can, poll your students or do health screenings or things like that, but schools are not expected to screen students for travel history or symptoms necessarily. So again, those students should be screened. Right now, there's not an area in the US that is considered to be a travel risk. We certainly do have areas that have person-to-person spread occurring, but nowhere is it at such a huge level that they're considered to be a travel risk.
Another question from Renee. Do you have someone answering calls over the weekend?
We have an email.
Okay. It's a little different at all 3 health departments. I'm being told at District Health Department number 10, which covers 10 of the counties, there is an email that's info@dhdten.org. All the health departments do have a 24-hour number for emergencies and if there are communicable diseases to report. So if you had an ill student and you had questions about them, yes, we do have a 24-hour number. As you can imagine, we are extremely overwhelmed right now, and so we ask that they truly be things that are emergencies.
At this time, there are no more typed questions. I would like to open the line for anyone who is calling in to ask a question. To ask a question, go ahead and press *6. That will open and unmute your line, and you may ask your question. And with no one asking any questions, I don't believe there are any.
Well, I thank you all very much for joining us. If you have questions, please contact us. Again, I ask for patience just in the next coming weeks and months because we are pretty overwhelmed with questions, but we will do our best to continue to respond as quickly as possible. But I thank you all for your time today. We'll get information out to you as quickly as we can from this talk. And I thank Luke for hosting us.
At this time, you may disconnect. Thank you.